Welcome to this educational journey, where we delve into the fascinating world of psychology. Here, on our channel, we aim to explore the depths of our minds, to shed light on the mysteries of human behavior, and to provide you with a greater understanding of the intricate patterns that make us who we are. Our purpose is not merely to impart knowledge, but to spark curiosity and foster empathy for those grappling with psychological disorders. Today we're going to take a closer look at a topic that holds immense significance in the realm of mental health, the DSM-5 specifier for feeding and eating disorders. These disorders are far more than just fads or phases. They're serious conditions that can have life-altering consequences. By understanding them, we can better support those who are struggling and challenge the stigmas that often surround them. Without further ado, let's dive into today's topic: feeding and eating disorders as defined by DSM-5. And in order to comprehend feeding and eating disorders, one must first get a grasp on DSM-5 and what specifiers are. Delving into the world of psychology, DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, is a guidebook used by mental health professionals worldwide. It's like a universal dictionary for mental health, providing definitions, symptoms, and criteria for diagnosing various mental disorders. Picture it as a language that allows psychologists, psychiatrists, and other mental health professionals to communicate effectively about mental health conditions. Now, let's move on to specifiers. In the context of the DSM-5, a specifier is like a subtitle or a tag that further describes a mental disorder. It's not an independent diagnosis, but an additional layer of information that helps in understanding the specific manifestation of a disorder in an individual. Specifiers give more depth to a diagnosis. By using specifiers, professionals can provide a more comprehensive description of an individual's experience with a disorder. For instance, in the case of major depressive disorder, specifiers can indicate whether the current episode is mild, moderate, or severe. They can also specify if there are anxious distress, mixed features, or melancholic features, among others. Essentially, specifiers help in tailoring the diagnosis and treatment to the unique needs of the individual. So in essence, the DSM-5 provides the framework for understanding mental disorders, while specifiers allow for an individualized description of these disorders. Both these tools are crucial for mental health professionals in diagnosing and treating various conditions, including feeding and eating disorders. In the coming scenes, we'll be using DSM-5 and its specifiers to delve into the depths of feeding and eating disorders. We'll explore their types, symptoms, causes, and treatments, and we'll also share a real-life story to help you better understand these disorders. Now that we have a basic understanding of DSM-5 and specifiers, we can move on to the main topic: feeding and eating disorders. What are they? These disorders are a group of conditions defined by abnormal eating habits that negatively affect a person's physical or mental health. They often involve either insufficient or excessive food intake, leading to detrimental effects on an individual's mental and physical well-being. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, feeding and eating disorders are characterized by a persistent disturbance of eating or eating-related behavior that results in the altered consumption or absorption of food and that significantly impairs physical health or psychosocial functioning. To put it in simpler terms, these disorders are not just about food. They are complex mental health conditions that often require the intervention of medical and psychological experts to alter their course. They can affect individuals of all genders, ages, body weights, ethnicities, socioeconomic statuses, and cultural backgrounds. The DSM-5, which is the standard classification of mental disorders used by mental health professionals in the United States, goes into more detail about these disorders, providing specific criteria for each one. This criteria is used to facilitate more accurate diagnosis and treatment. For example, anorexia nervosa is characterized by an intense fear of gaining weight and a distorted body image that results in self-imposed starvation and excessive weight loss. While bulimia nervosa is characterized by recurrent episodes of binge eating, followed by compensatory behaviors such as self-induced vomiting, excessive use of laxatives or diuretics, fasting, or excessive exercise. It's important to note that these disorders are not a choice or a phase. They are serious, potentially life-threatening conditions that affect a person's emotional and physical health. Understanding the nature of these disorders is the first step towards raising awareness, promoting early detection, and improving the prognosis for those who suffer from them. These disorders can manifest in many forms. Let's explore a few. Feeding and eating disorders are not all the same. There are several types. Each one uniquely impacts an individual's relationship with food and their body. Let's delve into this a bit further. First, we have anorexia nervosa. This is characterized by extreme weight loss or lack of weight gain in growing children, intense fear of gaining weight, and a distorted body image. An individual with anorexia nervosa will often go to great lengths to control their weight and shape, which can significantly interfere with their life and health. Next, we have bulimia nervosa. This disorder involves repeated episodes of binge eating, followed by compensatory behaviors such as self-induced vomiting, misuse of laxatives, fasting, or excessive exercise. People with bulimia nervosa often feel out of control during their binge eating episodes and are typically distressed by their lack of control. Moving on, we have binge eating disorder. This is the most common eating disorder and is characterized by recurrent episodes of eating large quantities of food, often very quickly and to the point of discomfort. Unlike bulimia nervosa, there are no regular compensatory behaviors to counter the binge eating. Then there's avoidant, restrictive food intake disorder, often seen in children. This involves limitations in the amount or type of food consumed, but without concern for body weight or shape. Lastly, we have pica and rumination disorder. Pica involves eating non-food substances such as dirt or paper, while rumination disorder involves the regular regurgitation of food, which is then re-chewed, re-swallowed, or spit out. And let's not forget about other specified feeding or eating disorder, or OSFED. This category includes disorders that don't meet the full criteria for any of the disorders we've mentioned, but still cause significant distress or impairment. It's important to remember that these disorders are not choices, but serious mental health conditions that require medical and psychological intervention. They can affect anyone, regardless of gender, age, race, or socioeconomic status. Each disorder has its own set of symptoms. Understanding these differences is crucial in recognizing and addressing these disorders effectively. Recognizing the signs is the first step towards understanding and helping. Let's delve into the symptoms that could suggest the presence of feeding and eating disorders. Symptoms can be broadly divided into physical and psychological. Physically, an individual might experience significant weight loss or gain, or in the case of children, not gaining enough weight for healthy growth. Other physical signs include feeling cold frequently, fatigue, dizziness, or even the onset of fine hair on the body, a condition known as lanugo. On the psychological front, a person might demonstrate an intense fear of gaining weight or becoming fat, even if they're underweight. They may express dissatisfaction with their body size, shape, or weight. And some might develop a distorted body image, perceiving themselves as overweight when they're not. Eating habits also offer clues. For instance, a person might start eating smaller or larger amounts of food than usual. They might start to avoid meals, eat alone, or hide food. There could be instances of binge eating, where the person eats an unusually large amount of food in a short time, followed by purging behaviors such as self-induced vomiting, misuse of laxatives, or excessive exercise to prevent weight gain. Other symptoms might include preoccupation with food, dieting, or body size, which can interfere with daily activities or relationships. In severe cases, the person might show symptoms of malnutrition, such as anemia or weakened immune system. It's important to note that not everyone with an eating disorder will exhibit all these symptoms. Additionally, these signs can also be associated with other conditions. Therefore, professional help is crucial for a correct diagnosis and treatment. Remember, detecting these symptoms is not about labeling or blaming. It's about understanding that someone might be struggling and needs help. It's about starting a conversation and offering support. So, what could possibly lead to these disorders? As we move forward, we'll explore the various causes that may trigger feeding and eating disorders. Feeding and eating disorders, like many psychological disorders, do not have a single cause. A confluence of factors often pave the way for these disorders to take root. Let's dive into some of the potential causes. Firstly, genetic predisposition plays a significant role. Just as you might inherit your mother's smile or your father's height, you may also inherit a propensity for eating disorders. Studies show that if you have a first-degree relative, a parent, sibling, or child, With an eating disorder, you're more likely to develop one yourself. Secondly, psychological factors can't be ignored. Individuals with certain personality characteristics, such as perfectionism, neuroticism, or impulsivity, are more likely to develop feeding and eating disorders. These traits can cause a person to fixate on food, body shape, and weight, leading to unhealthy eating behaviors. Thirdly, cultural and societal pressures contribute significantly. We live in a world that often idolizes thinness and stigmatizes larger bodies. This constant pressure to conform to an unrealistic ideal can cause a person to develop unhealthy attitudes towards food and body image. Stressful life events or transitions can also trigger these disorders. Adolescence, a time of significant physical and emotional change, is a common period for the onset of eating disorders. Similarly, traumatic events such as abuse or loss can also trigger such disorders. Lastly, let's not forget the influence of the media. The constant bombardment of images showcasing perfect bodies can distort a person's perception of a healthy body image. This can lead to dissatisfaction with one's own body and potentially to an eating disorder. However, it's important to note that these causes are not exhaustive or exclusive. They interact in complex ways, and their impact varies from individual to individual. There's no one-size-fits-all explanation. Understanding these causes can be the first step towards prevention and intervention. It's also crucial for those suffering from these disorders, as well as their loved ones, to understand that these are not choices, but serious mental health conditions that require professional help. Knowing the cause is half the battle. Let's look at how these disorders can be treated. Though daunting, feeding and eating disorders are not insurmountable. To overcome these hurdles, a comprehensive approach is often necessary. The first step in treating feeding and eating disorders is recognizing the problem. It's crucial to understand that these disorders are not about food, but rather about feelings and situations that make the individual feel out of control. The issue is not what they're eating, but what's eating them. Once identified, professional help should be sought. Psychologists, psychiatrists, and dietitians play a vital role in providing treatment. They can offer different therapeutic approaches based on the individual's needs. Cognitive behavioral therapy, or CBT, is a common method used. It helps individuals to identify and change unhealthy thought patterns and behaviors. Family therapy is another effective approach, especially for adolescents with eating disorders. This therapy includes the entire family and helps to create a supportive environment at home. Medication may also be part of the treatment plan. Antidepressants, anti-anxiety drugs, or mood stabilizers could be used to help manage any underlying mental health conditions like depression or anxiety. However, treatment doesn't stop at therapy and medication. Nutritional counseling is a key component. Dietitians can provide education about healthy eating habits and help the individual develop a positive relationship with food. In severe cases, hospitalization might be necessary to provide adequate nutrition and prevent serious health complications. Parallel to these treatments, self-care plays an indispensable role. Regular exercise, adequate sleep, and stress management techniques like meditation and mindfulness can complement the therapeutic interventions. Remember, recovery is a journey, not a destination. It takes time, patience, and a lot of self-love. Each step taken towards recovery, no matter how small, is a victory. It's important to note that treatment is highly individualized. What works for one person might not work for another, but with the right help and support, overcoming a feeding or eating disorder is absolutely possible. To better understand, let's hear a real-life story. Meet Jane, a brave individual who battled and overcame an eating disorder. In her early 20s, Jane found herself trapped in the grip of anorexia nervosa. The fear of gaining weight became so overwhelming that she started avoiding meals, exercising excessively, and obsessively counting calories. This disorder didn't just affect her physically, but emotionally too. She felt isolated, anxious, and incredibly self-conscious. However, Jane was determined not to let her disorder define her. She sought help and started therapy. It was a challenging journey, filled with ups and downs. There were days when recovery seemed impossible, but she pushed through. Alongside her therapy, Jane also attended support groups, where she found comfort in shared experiences. Over time, Jane managed to regain control over her life. She learned to accept herself, love her body, and maintain a healthy relationship with food. Jane's story is a testament to the fact that recovery is possible. Feeding and eating disorders are complex, but understanding them is the first step towards helping those affected. As we've journeyed through this topic, we've untangled the complexity of DSM-5, the standard classification of mental disorders used by mental health professionals. We've examined the various types of feeding and eating disorders, their symptoms and causes, giving us a more comprehensive understanding of these conditions. We also explored the different treatment approaches, reminding us that recovery is possible and hope is never lost. The real-life story we shared underlines the human element behind the disorder, giving us a glimpse into the struggles and triumphs that come with recovery. In understanding these disorders, we empower not only ourselves but others who may be facing these challenges. So let's continue to learn, to understand, and to empathize. Thank you for joining us on this educational journey. Remember, knowledge is power. Stay informed, stay healthy.